Thank you, Madam Speaker. Good amendment. Please vote yes. The consent of the governed. Our state constitution puts it plainly that governments at all levels derive their just powers from the consent of the governed. Madam Speaker, mandates from government agencies, by definition, resist the consent of the governed. Consent must be given before governance takes place. There are occasions, Madam Speaker, very rare occasions, where a mandate from a government agency is appropriate and necessary. But, Madam Speaker, I'm afraid in our public policy, in public health and other arenas, we have moved to a place where mandates from government agencies are almost expected. They shouldn't be. The most effective public health is suggestion, is education, is information provided to the citizenry so that citizens can make informed decisions and offer informed consent. The consent of the governed and informed consent. Let's get back to those notions by voting yes on this amendment. Thank you, Madam Speaker. Article 1, Section 11 of the Washington State Constitution. Absolute freedom of conscience shall be guaranteed to every individual. Absolute freedom of conscience. That is the constitutional basis for this amendment. In our matters of public policy, including public health, we have to acknowledge that the state constitution instructs us that it is our job as legislators to guarantee each individual's absolute freedom of conscience. That applies to religious belief, it applies to philosophical belief, and the crux of this amendment is that in our matters of public policy around public health, we have to allow for an individual's religious or philosophical objection to a point in policy. Article 1, Section 11, absolute freedom of conscience. This is a good amendment. This is good law. Whether it's for the individual or the individual's children or anyone, absolute freedom of conscience. That's the basis for this amendment. Please vote yes. Thank you, Madam Speaker. Please vote yes on this amendment. Madam Speaker, as long as WAC 246.100.040 is in place, implementing this kind of policy is problematic. That section of bureaucratic code, Madam Speaker, is the section of the WAC that discusses involuntary quarantine. And it is shocking to me, Madam Speaker, that it's still in our bureaucratic code in this state, but there it is. Madam Speaker, that WAC 246.100.040 is the reason for a lot of the broken trust and distrust that exists among the people of Washington toward the public health establishment. Now, a lot of that is unfortunate. The public health establishment, public health professionals, they mean to do well. But some of that administrative code, some of that bureaucratic code is extremely problematic. So as long as that code is in place, we need to be careful about putting language like implementing policy into our statutory law, which is, of course, superior to administrative code. It's an important distinction, Madam Speaker. It's a good amendment. Please vote yes. Thank you, Madam Speaker. The reason to vote yes on this amendment is contained in the First Amendment to this bill that we approved earlier tonight, or earlier this morning, or last night, or whatever it was. Permission to read the First Amendment that we approved earlier.
If it relates to the amendment, please proceed.
Oh, it does. Thank you. The intent language of Amendment number 310. The legislature does not intend by this enactment to modify, limit, or expand any existing requirement or establish any new requirement for any individual to receive any vaccine or take any other similar measure to control the spread of communicable disease. We just approved that a little bit ago. This bill doesn't do anything to prevent the spread of a communicable disease. There is no appropriate emergency clause on a bill that doesn't take any similar measure to control the spread of communicable disease. It is inappropriate, Madam Speaker, to have an emergency clause on this piece of legislation. Please vote yes to do the appropriate thing and remove the emergency clause.
Further remarks.